Hello. So we can't have
Hello.
Mark in the studio with us, but we can speak to you on Zoom. So first of all, are dentists actually open?
Yes, we are open. We have what they call a closed door policy, which doesn't mean the doors are effectively locked. What it means is we don't want people just walking in off the street to book appointments or just to see us. So the idea is patients should make appointments before they come and see us and before they're allowed into the building. We'll ask lots of questions anyway. So we, as I say, we don't just want people sort of just coming in.
So you're open and it's perfectly safe for us to come in?
It's very safe. I don't know whether it's safe, for dental treatment, as in, what I'd be like as a dentist, but no, it's very safe virus-wise for patients to come in to the practice itself. So yes, there's no issues that way. And now we can provide sort of all aspects of dental treatment. So we're not limited to initially. We were sort of limited to what the class is essential and emergency treatment. So now we can provide all aspects of treatment again.
Yeah, because the news came out today that dentists are now able to see routine patients again. So does that mean that literally anything goes? We can come and see you for any kind of treatment?
Yeah, any kind of treatment. I think the reason that the sort of dentists were reducing the treatment that we did was more to do with the fact that the government obviously had a kind of a restricted, not access, but they wanted to keep people sort of apart. They wanted to keep people at home. And the idea of that is obviously to keep people safe. So the more people are going out and about, whether that's to the supermarket, whether that's to the petrol station, whether that's to the dentist, the opticians, whatever, the risk is that you're then coming into contact with other people. And effectively, even if you're not mixing, you're still going through the same doorway. You're still you're still using the same petrol pump. I think loads of places have been great. I was getting some petrol the other day on the Peel Road, and I noticed the guy was there spraying down the pump handles and wiping everything down. So everybody's trying to do their bit, and they're all trying to manage the possible what we would call cross-infection risks. Obviously, for dentists at the moment, the message is now we can provide routine treatment. We still won't be up to full speed, but we can still get the patients in for the checkups, for the hygiene appointments, which they're not really classed as routine, because when we're doing a checkup, I'm sure most people have sat in the chair and the dentist sort of, looked around the mouth. They may have said, pop your tongue over to the left, pop your tongue to the right, put your tongue out. And what we're doing is an oral cancer screen. It takes seconds to do, longer to explain what we're doing than it does to actually do it. But it's obviously very important. Likewise, things like a hygiene appointment isn't just we're giving your teeth a clean. It might be that you've got teeth that are periodontally involved, which means they've got issues with the gum. So that needs to be addressed and it needs to be treated underneath the gum. So all those sorts of things that sound routine aren't really routine. But at the moment, we, as I say, as healthcare professionals, we appreciate the fact that the Kent variant, which is the one that we're facing at the moment, seems to be a lot more infectious. It's a lot more easy spread than the first variant that we had. So again, the message from the dentist to some extent was, if you need to see us, we're here. But for a lot of treatments, we were putting that on the back burner. And now, because the numbers have gone down, and again, nothing's changed dentistry-wise in the last couple of weeks. There's not any new information that's come out that says, oh, now you're safe, whereas before we didn't think you were. So, as far as we're concerned, we were safe before, but we took home the message that we've got to try and reduce people being out and about. So we were on board with that, with the government, to sort of, the message that we were trying to get across was, look, we're still safe, but, reduce the number of people that are out and about. But if you are at the dentist, it's a safe place to be.
And because we've talked about this before, the fact that, you know, as a dentist, you have always thoroughly cleaned. You've always had, you know, a certain amount of protection gear anyway. So for you, it sort of is business as usual as such. But there was a mention in the release about dentists now being open for routine that you need something like 20 minutes in between each patient. Is that something that you guys are going to be implementing?
Yeah, we back in June we sort of took on board various protocols from other parts of the world, and one of the vague grey areas is a thing called fallow time. It was thought quite early on that a thing called aerosol generating procedures were quite dangerous, and they could obviously be a risk that you've got to try and manage and deal with. Now, the biggest one of those is actually when you're intubating and removing tubes from patients who are on respirators in COVID wards. That's quite a high risk procedure. So again, because dentists use sprays and we use high-speed drills that produce a lot of water, a lot of spray. We've got ultrasonic scalers. The risk was that that's a dental aerosol generating procedure. So the sort of 20 minutes fallow time, if you like, is designed to let all the droplets, all the sort of the water particles settle so that they can be then wiped away effectively. Now, there's still no evidence to say that dental aerosol generating procedures or dental procedures are any risk. I think out of all the countries in the world, there's something like 48% of the countries still have what they call a fallow time. And that ranges from 2 minutes in some countries to 2 hours. And again, a lot of the evidence just says, well, we think it might be a good idea, but there's no evidence to say it is or it isn't. So for dentists, we're not leaving 20 minutes between appointments. The message is, if a patient has an aerosol generating procedure where we're using a high-speed drill, or we might be using an ultrasonic scaler, there'll be a fallow time of 20 minutes just to allow the particles to settle, and then the room can be sort of cleaned. But for the sort of simple things like checkups, dentures, orthodontic work, if we're not using the aerosols, then there's no need for any fallow time at all. Obviously, the problem then is if we're doing checkups for sort of 15 minutes, we don't want to have patients back to back so that we've got a waiting room full of people. So that can't happen. So what we might be doing is leaving people in the car park, and there might be a slight gap between patients, not because it's fallow time, but because it's just simply so that we're not getting people bumping into each other. And so we're sort of keeping the social distancing aspect addressed and at the forefront. So again, just so that we're not getting people mixing. And like you said, we still need time not only to sort of wipe and spray down the surgery and the surgery chair, but also the waiting room chairs are getting sprayed down and wiped down between patients. So the reception is up and down, sort of cleaning. The nurse in the surgery is up and down and cleaning. The nurse, the scrub nurse that might be sort of doing the instruments, she might be in and out of the surgeries. So there's an awful lot of cleaning going on still. But that's what we've kind of always done. I would say the reception has never looked so clean. It's really changed in the surgeries because we've always sprayed down, wiped everything between patients anyway.
Which is great to know. But as we said, it's not exactly as normal because, of course, there are still certain things that you have to do, isn't there? So when a patient actually arrives, what will happen?
Well, they may have been phoned the day before. They should have been phoned the day before just to sort of check that they're fine. There's no COVID sort of symptoms. They've not been in contact with anybody. And the patients are effectively being split into low risk and high risk patients. So someone that may be having symptoms or has been in contact would be classed as a high risk patient. So the low risk patients are still asked the questions. Then when they get to the practice, they'll probably ring the doorbell or they may phone. In our case, we've got a doorbell at Abbey Dental. But they'll then come in, we'll do a quick temperature check, and the lady on reception or gentleman on reception will then ask a series of COVID questions to make sure that, A, we've got the right patients, and B, that they don't sort of tick any of the boxes that we need to be worried about. So once they've done that, then theoretically, they should be able to go straight into the surgery. Again, we're trying to minimize the sort of waiting around sort of time, just so that again, it's contact. The idea is if someone's a little bit worried and a little bit concerned, they can go from their house to the car, to the practice, straight in, be treated, and then straight out. And as I say, payments, we're doing payments over the phone, payments, we might send patients sort of outside, wait till the other patient has gone through and then into the surgery, and then we might take the patient from the patient that we've just seen. So again, everything's just spaced, and the big, I say, inconvenience for the patients is more the fact that they're sort of waiting around. But again, for us, we're trying to space everybody, but also we don't want them waiting around. We want them sort of in and out as quick as possible, just to sort of minimize contact with people, with surfaces, with again, dentistry always thinks of everything as cross-infection. So anything that people are touching is a cross-infection risk. So we're just trying to minimize all the risks, same as we've always done, really.
Yeah. So at the moment, if someone's listening and they think, oh, I think I might need to go and see my dentist, what's your main message or sort of advice for someone who's considering coming to see the dentist at the moment?
Phone and book an appointment. If it's just routine, that's absolutely fine as well. If it's something that they think is a bit of a niggle, get the niggle looked at before it turns into raging toothache or a fat face, because obviously that's a lot more, just from a normal sort of point of view, that's a lot harder to treat than a niggle is. But just at the moment, we're still seeing patients, as I say, and we're still trying to manage any high-risk patients. But if a patient was high risk and in pain, we're limited as to what we can do. It would be an advised analgesics, antibiotics approach. If we absolutely had to sort of get treatment for them, we've got to try and arrange something that way. So we want to try and spot any problems before they become problems, get them dealt with quick. We're also seeing a lot more patients at the moment who have sort of said to us, I've had my first jab or I've had my second jab. Can I come and see you now? Do I have to wait? What's the story there? And again, what we said there is if you've had your first jab, don't wait to come and see us. But even if you've had your second jab, just assume that you're not protected. Just remember the vaccine is there, to give protection, but it doesn't mean you can suddenly stop wearing your mask. It doesn't mean you want to stop washing your hands. It doesn't mean you want to stop keeping the distance. It's just another sort of weapon in the armory, if you like. So you've got to remember that I think virtually all the dentists on the island have been offered their vaccinations, but we're still wearing our full protective gear. So although, we all fully believe in the vaccinations, nobody's turned around and gone, yeah, that's fine then. I can just treat patients, with a pair of gloves and a little mask. We're still saying, right, although we're protected, still full protection, so that again, we shouldn't catch anything from a patient and we shouldn't transmit anything to a patient. So you have to sort of treat every sort of situation as a possible risk. But certainly the message at the moment is the waiting lists are beginning to increase. Things are getting longer and longer and longer. So at the moment, we've still got a few gaps where people are now coming back to us. We've still got a few people that are a little bit nervous. You will find probably in a month's time, a lot of the practices will find that they've got no availability for a month, maybe 2 months. So you might phone up and say, oh, I just need a routine appointment. And it will be, yeah, great, we'll see you in July. We can still find spaces for emergencies, but then treatment afterwards is going to be a lot harder. So while the books are a little bit quiet as people are sort of beginning to get confidence again and sort of coming in, now's the ideal time to sort of come, because again, we've got space as well where we can space people out just to keep things safe. So I'm not saying it's not going to be safe in a month's time, but now is the time to sort of get any niggles certainly looked at and addressed.
And I assume the same thing goes for kids as well, for your younger patients.
Yes, absolutely. The only slight problem, again, because this new variant is possibly more infectious and seems to be spread more in schools. So what we're sort of saying, right, if you've got a tiny one, a toddler, it'll be sort of mum and the little one, or dad and the little one. We don't really want the whole family turning up en masse. If we've got a family that we need to see, that's fine, but it might be a case of everyone waiting in the car and bringing people through one at a time. just so that, again, we don't have, large groups of people. Even if it's one household, we're just trying to minimize the groups of people that will be in the surgery or in the practice. So it could be a kind of one at a time situation. But we've got quite a few sort of little ones, and we've got quite a few nervous patients that normally turn up with a carer or normally come up with a support person. So again, that sort of situation is fine. What we've done is we've said to them, right, wait in the car. When it's your turn, they both come straight into the surgery. We get details, and unfortunately have to ask the questions to both people. We get both the details, person's seen, and then out they go. So again, I think patients are they get a little bit fed up with, we've asked these questions yesterday, and it's kind of, reception will ask the COVID questions, then the dentist might ask the COVID questions again. So it's just being double safe and triple safe. And it's not that we don't believe you, but it's just that, we've got the boxes and the protocols that we've got to follow and the boxes that we've got to tick. So we'll make sure that we're staying on board with all of that.
Well, I'm sure that is putting a lot of people's minds at rest. Mark, thanks as ever. Just remind people again where they can find you and your practice.
So I'm down at Abbey Dental at Ballasalla, and the telephone number is 823040, and the email is abbeydental@manx.net, and you can find us on Facebook as well.